Happy Sabbath, everyone. Thank you for being with us this afternoon. For District 3 of the Southeastern Conference, we are about to do our first honor, viruses. Our presenter will be Dr. Bernard Felipe, and we will have Stacy Anderson, which will be doing a demonstration on the proper usage of PPE. Thank you all very, very much, and welcome everyone. Welcome to District 3 of the Southeastern Conference Pathfinder Ministry, Viruses Honor. Thank you. Hope you will have a wonderful experience learning about viruses. Popping up just about now, you will see the worksheet for your Viruses Honor. So you can download that, but if you're not able to do so, please have paper and pen, write your answers down, and then you can go back to your question sheet when you are able to retrieve them. Get these information to your director, and then she will make sure that you have done very well. I know you will. And then thereafter, you will be able to get your patches. Enjoy your adventure with viruses this afternoon. Just about now, we will have Dr. Felipe to introduce himself and just give you a little tidbit about what he does and his expertise in being able to present to us the Viruses Honor. What he will do in midstream of this, he will introduce to you the coronaviruses or COVID-19, because this is what's affecting us today. And we want our Pathfinders to know the proper usage of PPE and the dangers, the do's and the don'ts when it comes to COVID-19. So Dr. Felipe, it's in your hands. Thank you very much.
Good afternoon, everyone, and happy Sabbath. I'm happy to be with you today for this presentation. This is going to be a Pathfinder's Honor presentation on viruses, COVID-19, and other viral exanthemes. I am Bernard Philippe, and I'm a medical doctor currently practicing on the outpatient system with general practice, taking care of a variety of illness and prevention, disease prevention, and everything. So my practice is based in St. Petersburg, New Jersey, and I'm right there on Central for somebody who's looking for us. My practice is named Professional Healthcare Pinellas. This is the practice that I work for. We are a number of physicians in the practice, and I am one of them if you're looking for somebody. So today we have the honor, without, I know we want to be on time, without saying any more about me, because this presentation is not about me, it's about virus, but just a little bit that you need to know. I'm currently a practicing physician, and I'm a Seventh-day Adventist Christian, a master guide, and I'm here to serve. We're going to proceed with the Pathfinder Honor presentation on viruses, COVID-19, and other viral exanthemes, like we mentioned. Okay, I have a problem with moving up and down of the slide. It's not going to the next slide.
Dr. Felipe.
Yes.
Please stop your screen and reshare your screen, please. Let's go from there. In the meantime, tell us a little more about yourself. This evening, this is Ola Jory. Tell us a little more about yourself while your able technician is going through the process of getting your screen back together. You stated that you are practicing in St. Petersburg, but your statement was St. Petersburg, New Jersey. Is it a mistake?
Oh, Florida.
Florida, right?
St. Petersburg, Florida, I said. No.
Okay. And I notice you are presently attired wearing the Master Guide uniform, and you are actively involved in Master Guide. That's all, right?
Yes, I'm a Master Guide I've been a Master Guide for a long time, and I've taught a lot of honors for the Pathfinders before, like first aid and other type of honors.
I know District 3 will benefit immensely from your capable service here in the district. And as those that are watching you live from YouTube, they will be able to be benefited from the program. I just basically, while your screen is coming up, I'll mute out and let you proceed here with your program, sir. Thank you. Go ahead and hour down and get started, sir.
It's still not doing it.
All right. While we're doing that, I would suggest that you restart your presentation. We share your screen, start the presentation because it's not in the right mode that it should be in. And while we're doing that, while he's doing that, to restart your presentation, maybe you can tell us a little more about what to expect this evening in the virus presentation.
And as we know, the virus is a very, very, very large population, and um, we have a lot of viruses. And among all these viruses that we have, only 3,000 of them studied by scientists. The most variety of virus was not studied because they're so numerous, and it's part of every ecosystem in our world. So virus is very abundant. This is why it's important to know about viruses. There are some that we know that causes disease that we all are familiar with, but some of them we don't know about it because there are so many of them.
Okay, that's very excellent. While we're getting the kinks straightened out here, I'm wondering if it would be in our best interest to get the PPE aspect going, and we can get your PowerPoint slide up and running. So while we are in this mode to get your slide rectified, can we have Miss Stacy come on in so that we can clarify and show an exhibition of the PPE removal? Miss Stacy.
Okay, so to put on your mask, you're gonna the top part has a metal inside of it. So you take it and you put it behind your ear, and then you make sure that it's secure by your nose and underneath your nose and your chin area. And then you put on your gloves. Just make sure that it's secure everywhere and that it has no holes inside of it. So your gloves should have no holes inside of it, and then it should be tight in your size. And to take off your mask, you just pull from behind your ear and then throw it in the garbage. And then for your glove, you use the middle part and you pull it upward and you hold it in your hand with the glove on it. And then you take your finger and put it underneath it and then pull upward without touching the inside, and then put it in the garbage.
Sister Martin, our district coordinator, is there any question for Ms. Stacy before we move on to Dr. Felipe's presentation?
Stacy, would you be able to redo the removal of your gloves for us one more time, if you don't mind?
Back on first.
Stacy is a 2020 graduate, and we're so proud of her. She's a member of the Diamonds Pathfinder Club. She is, a very, I should say she is, how can I describe Stacy to us? She is one of our Pathfinders that I can call on for almost everything. She never says no. She's always ready to help, to assist. And because of that, I do thank the Lord that she became a member of our Pathfinder Club. And Stacy, congratulations for this hurdle that you've overcome. Whatever your goals are for you, I wish and I pray that you will continue to walk with the Lord, and also that you will continue to work in the Pathfinder ministry. I'm being very selfish, but I would love for you to continue to do so. And I wish you all God's blessing as you go, my daughter.
Thank you. So you pull from the middle part of your glove upward until your glove comes off. And then you hold the glove that you just took off in the middle of your hand, like really tight. And then you take your finger and put it underneath your glove and then pull upward until your glove comes off. So that the side that isn't contaminated is on the outside, and you could just take it and throw it in the garbage.
Thank you very much.
You're welcome.
While we're waiting for the presentation to begin, where Dr. Felipe left off, he told us about the amount of viruses that we have and how important for us to know about them, especially our Pathfinders, our young adults, our teens, that they know the basics on the viruses so they can protect themselves, their family, and their friends. And I think we're just about ready to begin. So Dr. Felipe, would you please take over? Thank you very much.
Are you seeing the screen, Mike?
Yes, I am.
Okay, good.
What are viruses?
We can see them. Okay, so what are viruses? Viruses are submicroscopic infectious agents that replicate only inside a living cells of an organism. So what they do, they can infect any type of life, animals, humans, including plants. They can infect any kind of life. And they even infect bacteria or archaea. Those are viruses. Virus could be very tricky. But remember that they cannot replicate, they cannot reproduce by themselves. When they infect a susceptible cell, what they do, they use the cell DNA to replicate more viruses. And thereby, they have more virus production. So viruses has the genetic composition as DNA and RNA. But virus has a general, like entire infectious virus particle is called virion. There is no life and it's inert. So it consists of a nucleic acid or a protein shell called capsid. And what does that do is protect the genetic material. And it could be also an envelope around the protein code when they are outside a cell, just to protect the virus. Okay, it might sound a little bit complicated, but just to tell you that virus cannot replicate by themselves. They depend on a host DNA to replicate themselves. So shape of virus, morphological shape of virus. We have about 4 shapes. We have filamentous virus. Filamentous virus are long and cylindrical. They mainly found in plant. Many plant virus. I don't know if you heard about tobacco mosaic virus. Tobacco mosaic virus was the first virus to be identified. Okay, we'll see that later on. Was the first virus to be identified. So tobacco virus, mosaic virus is a filamentous virus. So isometric virus, that's another shape. It's roughly cylindrical. And example is poliovirus and herpes virus. There is another type of virus, envelope virus. This is a virus that has an outer wrapping or an envelope what it does, it's this envelope comes from the infected cell. When the virus infects a host, it's from a process named budding off. So this process create an envelope that help the virus to survive and infect other cells. There is another type of virus, head and tail virus. This virus infect bacteria. You wouldn't think so. Bacteria is also a microorganism, yet virus can infect a bacteria. This shape of virus is icosaedral virus. This is a shape, and in tail shape like filamentous virus. I'm going to show you the shape. So here, this is on the left. On my left, I don't know what side it is for you, but on my left is icosaedral. It looks like cylindrical, and in the middle is filamentous, and at the far right, it's the head tail. You see the tail and you see the head of this. So all right, another one, you have the head tail. This one is the tail, and then the top one is the head. Filamentous is in the middle. When you look at the far right, you see the envelope virus right there. So importance of vaccination. I'm trying to go fast because we already behind with the time. So importance of vaccines to combat viruses. Does antibiotic work for viruses, against viruses? No, antibiotic does not work. A lot of time people make mistake thinking that we can use antibiotic. Once they have a cold, they come to the doctor, oh, doctor, I'm sick, I want antibiotic. So sometimes an antibiotic can make you feel better because it can help you abate the symptoms, but it does not work against virus. So which leave us with antiviral and vaccination. Okay, so how does vaccine work? Vaccine works by imitating an infection. What they do, the type of infection does not get you sick, but it causes the immune system to produce a certain antibody, T lymphocyte and antibodies, which is memory lymphocyte and B lymphocyte. What they do, they are produced by the immune system after a few weeks of receiving the vaccination. So the memory B and T cell, they will remember how to fight these pathogenic viruses as it re-enters the body. Okay, we're going to tell you how many types of vaccines we have, in the next slide. So here, type of vaccination of vaccine or vaccination. We have live attenuated vaccines. It fight virus. Live attenuated. Attenuated means decrease of strength. So you don't have the same strength. So what they do is a live virus, but in the process of creating the virus, they decrease the strength. They decrease the strength of the disease, of the illness, or of the virus causing the illness. And then when they inject it to you, so what happened? The body will react to it. And next time the body see something like this again, it's going to fight it. We tell you earlier that the body will produce antibodies that will recognize. Memory T cell is a memory T cell that's going to identify this pathogen and going to fight it next time the virus or something similar enter the body. We have many types of live virus. We have the MMR, which is measles, mumps, rubella, and we have varicella. We have oral polio, which is not given any longer. Oral polio vaccination that's given now is intramuscular. And then we also have Zostavax, which is used for shingles. And we have influenza virus, like flu virus, vaccination. And we also document that the live vaccine are contraindicated in people with weak immune system. So, for example, somebody with HIV with a very, very high viral load, low CD4, CD8 count, you won't give them live vaccination. Okay. So, inactivated vaccine. What do they do in inactivated vaccine? They inactivate the virus while they're creating the vaccine. The vaccine is not live. Okay, it's different than live vaccine. That's why you will see for inactivated vaccine, you need multiple doses. One dose will not be enough. They have to vaccinate you and then give you booster vaccine after a certain time. So the type of vaccination that is inactivated, the type which is tetanus, diphtheria, and pertussis. This is one example, but you see that I put bacteria in parentheses because it's not a viral vaccine. It's not a virus vaccine. This is a bacterial vaccine. Okay, so mutation is very important. Mutation is important in terms like the virus mutate, and what causes mutation as the virus replicates, multiply, and the body it uses what they call a DNA polymerase. DNA polymerase is very important in gene transcription and translation, and in terms of multiplication of a gene or whatever it is. So the virus uses the DNA polymerase of the host that is infected, so it can create more virus. But in the process, some of the virus lost their original genetic composition. So when they lost the original genetic composition, they become mutated. And that's why sometimes we have resistance, sometimes we have reinfection. You think the person is getting better, but because the virus mutate, the person can get reinfected again. Have viral disease ever been eradicated, and why is it so difficult to treat virus? What is eradication? Eradication is the reduction of an infectious disease prevalence and the global host population to zero. It differs from elimination. Elimination means you decrease to zero cases in a regional population, not a global host population. Okay? We have two different diseases that was eradicated. Smallpox was eradicated, and there is another disease named rinderpest. Rinderpest was also eradicated. How were they eradicated? They were eradicated with vaccination. The English physician Edward Jenner discovered the vaccine for cowpox. Cowpox was the pox that was infecting a lot of cattle, a lot of cow. So when Jenner discovered the cowpox vaccination, he also challenged it, tried against some smallpox, some people who was being infected for smallpox. And this is where we see that this vaccine also is effective for smallpox. Then smallpox was eradicated. So rinderpest also was infecting a lot of cattle, domestic buffaloes, and some other species. In 1900, they discovered live vaccination, which also eradicated rinderpest. So viral infections are hard to treat. Why? I know you're asking me why. Why is it hard to treat? It's because the virus, once it's infected a host, or once it's get inside a host, it's live within the DNA or RNA of the host. So now it's being protected. So now when you give the person medication, especially the medication has to use the bloodstream to get to the virus, then the virus is protected, then he take its course. So it's not gonna be responding very well to the medication. That's why we have the best weapon is the vaccination. So different type of viruses. If you can read with the screen, on the screen with me, let's read together. Enterovirus, adenovirus, varicella zoster, measles, rubella, mononucleosis, mumps. Mononucleosis is Epstein-Barr virus. Epstein-Barr virus, that's what caused mononucleosis. And influenza, Norwalk virus, Roseola, fifth disease. Fifth disease is caused by a virus named parvovirus B19. Parvovirus B19 caused fifth disease. Hand and mouth and foot and mouth disease caused by a virus named Coxsackie virus A16. Hepatitis A, B, C, D, E virus. We have 5 types of hepatitis. Okay, we have coronavirus, we have H1N1 virus, influenza A, and swine flu virus, and we have influenza B virus, influenza C, and rotavirus. Remember, I told you there is a lot more virus than that, but I just named some of them. So if you know who Dmitry Ivanovsky is a Russian botanist who was the first person to discover a virus in 1832. This is one of the founders of virology. So we have known about 5,000 species of virus was described and studied in detail, but we have millions of viral type that we don't know nothing about. We have 5,000 which was studied, but millions virus existed, but we don't know much about them. That's why viruses are very abundant in our biological and our ecosystem. So viral exempting, we talk about them. What is viral exempting? Viral exempting simply means that you have a diffuse rash, but there is no other things that responsible for it. And then the 6 things that could be responsible for in children, especially for this type of rash, they are measles. You heard about that before. Rubella, measles or rubella. And we have rubella, which they call German measles or 3 days measles, varicella, which is chickenpox, and 5th disease, we said that it's caused by parvovirus B19 and Wassiola. So rubella, also called German measles or 3 days measles, this is a contagious disease caused by viruses. Symptoms, you might have a rash. Listen to that very, very carefully. The rash of measles starts on the face and spread down to the rest of the body. Start on face, cephalocodal. Okay, so low-grade fever, swollen lymph node, joint pain. Complication might be birth defect. If you are pregnant and you have rubella, bad news, you might have a baby with cardiac defect, birth defect, mental retardation, liver and spleen damage. How does it get transmitted? It gets transmitted with coughing, with contact, sneezing, type of thing. How do we prevent this? Through vaccination, MMR, measles, mumps, and rubella. So now, measles. Measles could be dangerous, okay? Measles could be dangerous to babies, including symptoms include runny nose, red eye, conjunctivitis, caplic spot in the mouth, but you will have a rash that comes out after the symptoms begin, okay? After the symptoms begin, all those fever, conjunctivitis, you will have a rash that will come. So symptoms usually begins 14 days after exposure, okay? Worldwide, listen to that very carefully. Worldwide, 20 million people get measles worldwide, even with vaccination, okay? 146 million people die, 146,000 people die from it. The disease spread rapidly in areas where people are not vaccinated. Sometimes people refuse vaccination for one reason or the other. This is what can happen when people are not vaccinated against the measles. So chickenpox. Chickenpox is caused by varicella zoster. It causes blisters, like rash, in different stages of healing. Fever, rash, fatigue cause severe illness in babies, adults, and people with weakened immune system. Keep that in mind. People with weakened immune system, babies, and all other people, but people with weakened immune system is more at risk. If you have people being treated with cancer, having kidney dialysis, having HIV, any type of thing that can decrease your immune system, make sure they stay away from people who have chickenpox, anything like shingles. That those things they should avoid them. So this one is a little bit respiratory also. You can catch it by respiratory or contact precaution. Okay, so if you have to do contact precaution or respiratory precaution when somebody have measles, so within 5 to 10 days of exposure, people tend to develop measles. Okay, symptoms occurs within 1 to 2 days before the rash appears. The symptoms always come before the rash. These are some pictures. This is some pictures of measles. Okay, this is in the chart part of the body. All right, so this is another picture of measles. You see, it starts on the face first, then to the rest of the body. This picture is rubella. It looks a little bit like measles. This is the back of the person with rubella. This is another rubella case. This is somebody who's a kid. Take a look. This is a kid that was born with rubella. Okay, some kids baby can born with rubella. So sometimes it's affect the heart, it cause mental retardation, it cause a whole lot of stuff in babies. Okay, so this was a rubella baby affected, congenital rubella. And next slide is a varicella slide, chickenpox. You see how it look? Chickenpox, it look like virus stages of rash. They look like blisters. Some of them are healed, some of them are on their way to be healed, some of them are fresh. Different stage of healing. This is a rubella. All right. No, this is a chickenpox. All right. So next slide, chickenpox again. Another chickenpox. And this one, anybody want to take a guess? It looked like a slap cheek. Slap cheek. All right. This is fifth disease. Fifth disease look like a slap cheese. It caused by a parvovirus B19. Very dangerous to people, to pregnant people. It can cause a pregnant person to go into early labor or abortion. Very dangerous. Okay, it's not dangerous to the kid, but to the pregnant woman with exposure to the kid sick can cause abortion or early labor. Uh, Next slide, another fifth disease. Look at that. It looked like a slap face. Next one is another fifth disease. This is the rest of the body. Start first on the face, then to the rest of the body. Next one is, anybody want to take a guess here? This is hand, mouth, and foot disease. Hand, mouth, and foot disease. And we say that it was caused by one of the genus of the Coxsackie virus. This is Coxsackie virus A16. This is what caused foot, hand, mouth disease. Look at the mouth here. You know, the mouth is full of rash and full of blisters. Look at this other tongue here. It looks like a geographic tongue. People like this won't be able to eat food, especially if the food is very spicy. Now they're in trouble. They're going to have a burning mouth. Then you have to use medication like a lidocaine, viscous lidocaine, to numb the mouth to make sure that the person don't feel all this discomfort of the mouth. So next thing we have here is the polio. Polio is very important. Anybody want to take a guess? Which one of our presidents had polio? You know, we have a president that has polio, an American president. If you remember Roosevelt, President Roosevelt has polio. Okay, so the polio was doing a lot of it's a very deadly and life-threatening virus. It can cause paralysis. People, until now in my clinic, I see people with polio with paralysis of one of the limb. It could be leg, could be arm, because what it does, it affects the motor part of the spinal cord. The anterior horn is get affected by the polio virus. So that's why it causes paralysis. So polio is transferred from person to person. It's transmitted from person to person. Original symptom is fever, headache, tiredness, stomach pain, paralysis, paresthesia, meningitis, highly contagious. People can get it. It can stay in people's throat and intestine. It can hide there. Okay, so washing hand is very important. Always wash hand. Anybody that you have been in contact with. This is the universal way to prevent all form of transmissible disease. So virus also can be found in people's stool. Okay, so this is another important vaccination: polio vaccine, IPV, intramuscular polio virus. We used to give oral virus for it, oral polio virus vaccination. We don't do that anymore because oral polio is live, because we can't give to everybody. We can't give it to everybody because certain people you give it to, they might develop the disease. And if they develop the disease, it might be catastrophic. This is why we don't give the oral polio virus anymore. We give the injection. The injection is inactivated. What do I say? The injection is inactivated. All right, so here, dengue fever, people from the Caribbean, let's buckle up. We have dengue fever here. Dengue fever is more common in the tropic and the subtropic. How does it get transmitted? You get bit by mosquitoes. The mosquito genus is Aedes aegypti or Aedes albopictus. Those type of mixed mosquitoes, they cause all other diseases. They cause Zika, they cause chikungunya, If you can say the name, that's fine. If you cannot say chikungunya, that's chikungunya. That chikungunya is come from the same bug that if it bites you, it can cause dengue, can cause chikungunya and Zika. Okay, all those diseases, they have the same manifestation, except for dengue. They will have a manifestation where you have rash, you have eye pain, you have a headache, you have muscle pain, you have bone pain, you have nausea, you have vomiting, you have internal hemorrhage. The deadliest thing that can happen is the internal hemorrhage, because your platelet can come down, can go down, and then that's where your internal hemorrhage come from. It's very deadly for pregnant women and infant. We have to keep an eye on people who have dengue, because within 24 to 48 hours after the fever is gone, then this person might be in trouble, because if we don't wash them, platelet can come down, then they can have hemorrhagic dengue, very dangerous for female, pregnant women, and infant. Keep that in mind. So hepatitis, we think about five type of hepatitis: A, B, C, D, E. Most people only know the hepatitis B and C, or even hepatitis A, because sometimes you get it when you eat at a restaurant where people are not washing their hands. They have hepatitis A, they transmit it to you because they prepare your food with a hand that's not washed, then they transfer it to you. Hepatitis A only can be transferred through food, not through blood, not through sexual contact, not through sharing needle. Very different from hepatitis B, C, D. Okay, so now it's very self-limited. It can never become chronic. Sometimes you might have fatigue, abdominal pain, low appetite, nausea, vomiting. That's about it. Hepatitis B is a liver infection. You have infection of the liver. How does it get transmitted? Through semen, like sexual contact, to body fluid. You touch somebody's body fluid, they then wash your hand and you eat, then you might have that. So sexual contact, sharing needle from among the drug abuser, they needle doesn't get sterilized, they use it again, then they get hepatitis B. Hepatitis B symptoms could be fatigue, dark urine, loss of appetite, abdominal pain, nausea, clay-colored stool, joint pain, and jaundice. Incubation period, very long, from 2 months to almost 4.5 months, 150 days after exposure. So you get exposed, you think that everything is okay, and boom, all of a sudden you're having flu-like symptoms, you're having body pain, abdominal pain, fatigue, then it could be hepatitis B. So the most dangerous thing about hepatitis B, it can become chronic. You can develop liver cirrhosis and liver cancer from that. Hepatitis C, same thing. You can have the same symptoms. You can develop liver cirrhosis and cancer. But the thing about hepatitis C, it's also bloodborne. If you get blood transfusion from infected people, you can get hepatitis C. But mostly people who have it is people who use drug, who use needle, unclean needles. They catch hepatitis C from this way. Most people, 50% of the population with hepatitis C might get over it, but 50% also might die from it, might have cirrhosis and liver cancer. The type of cancer you get from that, they call it hepatocellular carcinoma. All right, hepatitis D. I know this one, you're probably not too familiar with it. Hepatitis D, it looked like a little brother to hepatitis B. D as in David look like a little brother to B, because sometimes most people with hepatitis B will have hepatitis D. They call that delta antigen. Okay, hepatitis D is delta antigen. What it does, you get it also through blood, okay, from infected people. So the symptoms are the same, but there is no vaccination for hepatitis D. Hepatitis E. Hepatitis E is also almost like a little brother to hepatitis A. We make a little fun about it. You ate it or you eat it. You ate it or you eat it. Okay? You ate it. It is the first letter for hepatitis A. You eat it is the first letter for hepatitis E. That's meaning they both are foodborne pathogen, foodborne thing that you get from food. People not washing their hand and they prepare your food, or you or the hygiene, restaurant hygiene is not too clean, then they transfer this disease to you. That's hepatitis A and E. both from food, hepatitis C, B, and D, all from blood sharing needles. All right. So next one is differences between cold and virus. How do you make the difference between cold and virus? We have three types of flu. A lot of people didn't know that. Three types of flu. We have flu A, flu B, and flu C. When I say flu, I mean influenza. That's the scientific name. Influenza A, influenza B, and influenza C. The most common one is influenza A. Influenza A is affect both human and animal. Okay, and it's more prevalent. It affects more people and it's more severe. And influenza B is also affect a lot of people, but does not affect animal. Okay, influenza now, influenza C, influenza C also affect only human, but it's less severe than influenza A or B. Okay, influenza A or B are more severe than influenza C, but influenza C impact more children and older people. If you see a children or older people have influenza or flu-like symptom, the most common one probably is gonna be C. That doesn't mean the other kind will not happen, but it's most likely gonna be C. Cold virus, we're almost done here. Cold virus referred as upper respiratory infection, and there are 100 types of cold virus. But the most common cold virus is rhinovirus. Rhinovirus can cause sneezing, coughing, runny nose, and ear infection in children. So flu can affect both upper and lower respiratory. Flu can cause pneumonia. It can cause upper respiratory infection, while cold virus rarely cause lower respiratory. Lower respiratory is the lung, lower respiratory. Upper respiratory is part of the pharynx, is the esophagus and type of thing. Those are, and trachea, those are upper respiratory. But lower respiratory, flu virus can cause pneumonia, and flu virus can cause pneumonia, as cold virus can also cause pneumonia too, but flu virus cause more type of pneumonia than a cold virus. Okay, so the difference is flu virus is more aggressive. Flu virus can end up cause pneumonia. Cold virus might not, but it might cause it occasionally. All right. So now another difference: viral pneumonia. Viral pneumonia may happen in people less than 2 years old or people older than 65. So cold virus, viral pneumonia will happen in people less than 2 or older than 65. We have many strains of viruses, okay? Many strains of viruses and many subtypes of viruses. They all can cause pneumonia, okay? But you might have bacterial pneumonia, you might have fungal pneumonia, okay? Fungal pneumonia and viral pneumonia can also result in. Sometimes when we say pneumonia, before, a lot of people think it's only bacteria that cause pneumonia. No, flu can cause pneumonia, virus can cause pneumonia, and even fungus can cause pneumonia. Symptoms of cold. Symptoms of cold are runny nose, stuffy nose, sore throat, cough, congestion, mild headache, body ache, low-grade fever. Flu virus can cause all that. Those are cold virus symptoms, but flu virus can cause all that. But look at the addition. I want you to pay attention. Look at the addition. The addition is flu virus can cause fatigue, vomiting, diarrhea, and chills. Usually, cold virus does not cause fatigue, does not cause vomiting, does not cause diarrhea, does not cause chill. Next one, difference between flu and cold continued. Okay, flu virus. Who wants to take a guess? Flu virus symptoms, it's abrupt, sudden. You look like all of a sudden you get hit by a truck. You're weak, your body ache, and then you're nauseous, you have fever, you have headache, you have sore throat. All of a sudden, there was nothing that give you a warning sign. You get pushed, boom. This is flu virus, okay? So what about cold virus? Cold virus is cold symptoms are more gradual. You know, you feel like today, oh, you know, I'm coming down with something. I might be coming down with something. I don't know what it is. This is cold virus, very lingering, you know, slow. What did I say? Flu virus? Boom, boom, boom. That's flu virus. Okay. So now, cold virus can last up to 2 weeks, but most clear by 1 week. Okay. Patient can be contagious for up to 3 weeks. Don't say like somebody is getting better. Oh, and tell you know she has a cold last week. She's getting better. She can get it up to. She can be contagious up to 3 weeks. So if I get better or from my cold virus, that doesn't mean I can sit there sneezing right by you, you know, and then it's okay. Up to 3 weeks, I still can transmit it. Okay, so flu lasts the same amount of time as cold. Okay, your body need about 3 weeks to fight it. Get out of the system. Get out of the system. We need three weeks, 3 weeks minimum. So conditions, more people with serious health condition, smoker, elderly can experience more intense symptoms from simple cold. But this is a note that I want you to pay attention to. For persistent symptoms, including pain around your eye, your face, with nasal discharge after a week, make sure you see your primary care physician. This could be bad case of sinusitis. If you have bad case of sinusitis that can infect that can cause problem around the periorbital area, and you can end up with we can have bacterial growth there, superimposed bacterial growth, then you're in trouble. You can be in trouble. So if you do home remedy for about a week or two and you're still not feeling well, you're still not feeling improvement, please see your PCP, primary care physician. You can come to see me in Central, or you can see somebody else. You can come to see me in Central, St. Petersburg, or you can see somebody else. So drink a lot of fluid and rest. So the medication you can take for fever is Tylenol, just to reduce the symptoms. Influenza pandemic, I know you know about that already. Pandemic of influenza. We have, pay attention, pandemic of influenza, very close attention. I want your attention on that. It's very important, very important. So pandemic in 2009, we have a pandemic. We have influenza pandemic of H1N1. I remember that. In April 2019 and up to April of 2009 up to April of 2010, we have this pandemic. How many people was affected? About 60.8 million cases in the US. And how many people was hospitalized? 274,304 was hospitalized. And how many cases of death was 12,469 death in the US. That was the H1N1 influenza A, what they call swine flu, if you remember. What about the Spanish flu? Anybody knows about that? The Spanish flu was bad, terrible, terrible. Anybody listening? Any of the kids listening? What did I say? Spanish flu was bad. When I say bad, it's bad. Spanish flu occurs in 1918. In 1918, I heard people were saying it, but I didn't know the name. My grandma used to say it, but I didn't know the name. It's caused by H1N1 with the same gene of avian origin. Avian means birds. All those things, all those strong stuff from wild animal, birds, and some other stuff. 500 million of people worldwide was affected. About 1/3 of the whole world population was infected by the virus. How many people was dead? 50 million people was dead worldwide. And how many cases of death the US have? 675,000 deaths in the US alone. It is considered the deadliest pandemic per CDC. So next, avian influenza. Avian influenza. We remember I said avian, almost done here. Avian influenza bird flu. Bird flu is come from bird, like you said, from bird. It's more like in India, Indonesia, in Vietnam, China, kill about 60 people from there. H5N1, H5N1 is the prototype here. And next one, differences between prion and viruses. Prion and viruses, they look alike. The infection presentation look alike, but they're not the same microorganism. So prion doesn't have a DNA. Prion does not have DNA, but virus has DNA. Prion are protein, infected protein, and then they propagated and they cause infection. So if you know about prion. So next one is prion infection, spongiform encephalopathy, bovine spongiform encephalopathy, Creutzfeldt-Jakob syndrome, Kuru. Kuru, we used to have Kuru infection. People was eating people in West Africa, New Guinea. So they were eating their grandparent or their parents when they died. So they were acquiring this brain disease named Kuru. Okay, so so what it does, it affects the structure of the brain and other neurological disease. So you have a bad, terrible brain disease, and I see bad, terrible brain disease with this. So coronavirus, if you want to hear about it, the next two slides, I see a lot of sign. This is the actual thing, so we'll be brief. About 2 minutes from that. So coronavirus pandemic occurs in 2019. It's it's from the same genus as SARS that we had before. It was not as bad as coronavirus, but it's the same family as SARS. It's a beta coronavirus. It's transmitted by droplet in contact with 6 individuals. So incubation period is 1 to 14 days. So approximately in 4 to 5 days, people after exposure, people might have coronavirus. So patient with cardiovascular disease, hypertension, chronic lung disease, diabetes, chronic kidney disease are more prone to coronavirus. Okay, so COVID-19 or coronavirus, what do? It affects people with weak immune system, older people in middle age, but anybody can get affected. Infectivity period, 1 to 20 days. If 1 to 20 days, stay home if you know that you have corona. Don't be around transmitting it to other people. Symptoms include cough, sore throat, runny nose, body ache, fever, headache, shortness of breath, pneumonia, loss of taste, loss of smell, rash, diarrhea. So all those are coronavirus symptoms. That doesn't mean you're going to have all the symptoms. You might have 1 or 2. If you suspect that you've been exposed, please get checked for it and then quarantine yourself. Symptomatic treatment include hydration, isolation, antipyretic, Tylenol for pain and fever. If symptoms persist and become more severe, notify your PCP. Last slide, I think, when to continue home isolation. If you are isolation for corona, when your fever go down without using Tylenol or ibuprofen or any sort of fever reducing agent, then you start being okay to get off isolation. So negative test for COVID, 2 negative tests they want. They want 2 negative tests within more than 24 hours. If you have 2 negative tests after tested positive, then you can go off your isolation. So if you have 7 days without symptoms, from the time that you have the first symptom and 72 hours without no symptom, then you clear to get off isolation. Here, prevention, we talk about PPE, personal protective equipment, social distancing, 6 feet apart or more, like CDC recommended. Wear your mask if you go into places where it's a high risk. If you work as a healthcare, wear your mask, wear your glove, wear your gown when it's necessary. Cover your mouth when you sneeze or cough. Drink plenty of fluid. Exercise daily and eat a lot of fruits and veggies. Rest, very important, and eat food that is high in alkalinity. Food that is high in alkalinity. They give certain type of food. They give Pineapple, they say pineapple is good. They say that anything like has cinnamon, a whole lot of food that it is high in alkalinity we can use. Apple, but no vaccination is available yet. No vaccination available yet. And the most important thing, pray our living God to put a stop, because we as a individual, as a scientist, trying to do all kind of things, but those things, they are in progression. But only God can put an immediate stop. And that's in our presentation today. So I have to, it's a lot of information. I have to run through them. But this is that in our presentation for today. Thank you all for listening and for giving me a chance to talk to you today. May God bless you.
Thank you, and Dr. Felipe, for ladies and gentlemen, please send in your questions. We would like to answer some of them. If you have questions to be answered, Dr. Felipe is here to answer your questions for you. And also, please share. We want you to share the information that you have gotten today so that others may be educated on the viruses. You have heard how important it is for us to protect ourselves. We have learned new things about viruses. And so I hope and trust that you will ask questions. So if we don't ask questions, we will not be educated. So please, please, please. Remember to go to the site bethlehemsda.org for your question sheet, your worksheet. Have those questions answers that you've written down, have them written on your worksheet, give those to your directors, and they will let you know if you have completed it properly so you can get your honor. I hope you have enjoyed this. I hope you have learned, and I hope you will be able to share with others what you have learned today. Send in your questions. I have not seen any questions as yet. Please send in your questions. Okay, what I would like to say to you, if there are any honor that you would like for us to bring to you, just send me a text, send me messages, and we will try to find presenters that will give you the information or present that honor to you in the best way we know, or he or she knows how to do it, so that we will be properly educated and we'll be furnished with our honors for our sashes, so we'll be well decorated. And also not just being decorated, but also that we have learned something so we can share what the Lord has blessed us to absorb. So I want to thank you all. And we're going to have prayer at the moment. We want to thank Stacy for participating with the PPE. And also I would like to congratulate her on becoming 2020 graduate. Thank you all, everyone. I hope you have enjoyed. Let's bow our heads in prayer. Father, we truly thank you for today, your Sabbath. We can come together to learn more about you. We thank you for the presenter today, Dr. Felipe. We ask that you cover him with your righteousness, keep him safe, and Father, continue to enable him to spread the word, the truth, and the preventative precaution in keeping us well and healthy to be your servants. Father, we thank you for the technology team. We thank you for Stacy. We thank you for all those that have heard and have gotten the information today. Continue to bless and to provide. Continue to inspire us. And Lord, I say thanks, thank you, in Jesus' name, amen. Have a good Sabbath. Bye, everyone. Enjoy.
Bye. Enjoy. Thank you, everyone. Thanks to the host, Brother Mark, Brother Jerry, and thank you, Brother Sister Martin.
You're welcome, Dr. Bernard.
Okay, thank you,
Thank
Pastor
you, Brother
Clark. Everybody
Jory.
that's on the line.
Thank you all, Brother Jory, Mark. I'm not sure if our pastor was on, but I want to say thanks for giving us the opportunity to share. And your questions, we want for you to send the questions, we will answer them, or we will give you information that we possibly can get to you as soon as possible.